Thank you, Mr. Chairman. Gentlemen, thank you. This is not a day that's probably a fun day for you. You probably didn't get up and go, gosh, I can't wait for this day. I get that, and I want to say thank you to you because all of you are professionals that have given to public service. You all could make a lot more money in the private sector, and you've chosen to serve people. And we're going to have differences of opinion on direction, that kind of stuff, but I just want to say thank you to you as well for what you're doing because you have made a conscious choice in that. Let me walk through a couple of things just to be able to get some of the reality on it. About an hour and a half ago, I went on my iPad and got to heatlhcare.gov, and I hit this button that says create account, and it doesn't go anywhere. And it just changes colors and does nothing. And so I reloaded on this, and for about an hour and a half, I've just occasionally hit that button. This is the frustration and the struggle that a lot of folks have, and that y'all have the frustration with. We get that. We have the questions, though, as we walk through this process of now what happens. Mr. Park, you were asked the question earlier about the November 30th timeline. Obviously, Mr. Zients has laid that out there as the end of November when everything would be ready and available. You said it is our goal. Can you give me more specific? Are we going to hit November 30th?
Thank you for the question, and thank you for your kind words at the beginning as well. So the goal that has been laid out is for the site not to be perfect by the end of November.
Functional, people can log on.
So that the vast majority of Americans will be able to use the site smoothly. That's the goal we're gunning for. We're working very hard to get there.
So here's the issue. Around 5 million people have received a cancellation letter. I have multiple constituents that have sent me copies of their letters. All of them end with, your insurance policy concludes December the 31st. If they cannot get on and log into this site by December the 15th, they will not have access to insurance January 1, and they will be uninsured. People that are currently insured will not have insurance as of January 1. So I understand that the deadline is out there for March 31 and all this kind of stuff on it. Those individuals that have received it by the millions cannot get insurance, and January the 1st will be uninsured. So I get that's the goal, but the reality is racing at us. And the comment's been made on it that we're trying to fix a plane that's in the air. I fully understand the complexities of that. The challenge of it is that many of us had said, park the plane for a year. Let's get it right before we launch this thing. That's not your fault. Y'all are dealing with the realities that are on the ground on it, but that's something that we're trying to communicate on this. Mr. Chow, I do want to ask you something. The September 27th, the ATO, the authorization to operate. In some of the committee staff that you had mentioned, that was a very long day as well, to be able to visit with committee staff on it. During that conversation, there was a back and forth on this ATO coming out that Mr. James Kerr and yourself that you had edited there. It's sent to Marilyn Tavenner. In that memo you wrote, due to a system of readiness issues, the security control assessment was only partially completed. This constitutes a risk that must be mitigated to support the marketplace day one operations. You were asked by staff, what are some of those risks that are out there that are kind of the unknowns on it that have to be mitigated? During that conversation, you had listed things like unauthorized access, not encrypting data, identity theft, misrouted data, personal identifiable information. Those are kind of the great unknowns of this at that point. Then, am I tracking this correctly? You remember this?
Yeah. Those are examples that I was asked to provide.
Sure. The problem is that you're trying to mitigate on things that you don't know. I understand about mitigating on risk. You mitigate on things that you know. Is that correct? So how did you, on day one, Marilyn Tavenner is signing a document saying there are risks that are out there. Some of those that you listed, we're going to have to mitigate on those. Were we mitigating for every possibility on it?
I think what you do is you under a risk-based approach, you look at the probability of a particular risk occurring, and you prioritize. And for example, one of the mitigation steps was to conduct weekly security testing and to report back to the administrator on the results of that security testing.
Sure. During that testing process, did you find that some data was misrouted? Once it was launched, are insurance companies getting information that's incorrect?
There were cases in which insurance company was getting data that were not incorrectly routed to them, but incorrectly formatted within the transaction.
Okay. Do you know who briefed Marilyn Tavenner on the security risks? Because obviously she had to sign off on this document. Do you know who sat down with her and briefed her? risk. Here's all the things that we're trying to walk through.
It was our Chief Information Officer and Chief Information Security Officer.
Two other quick questions. Is there a way to be able to track what personal information any employees can see while they're working on this? Obviously, we had a lot of contractors involved in this. Now we've added even more contractors, trying to learn all those contractors, who they even are. Is there a way to be able to track? Because now there's personally identifiable information in the system as well. Is there something in place that tracks what people that are working on the back end of the site can see as far as personally identifiable information?
Yes, there are system logs. Like, for example, if you call the call center and the call center representative is...
But I'm talking about people working on the back end.
Gentleman's time has expired. You can finish the question.
In certain cases, yes, like if you're in a testing environment, very few people touch a production environment, so they wouldn't even have access to that live data. So sometimes when we use testing data, you want to see the results, so you do have developers having access to that information, but it's not live people's data.